Welcome everybody, and thank you ever so much for joining us this afternoon. My name is Lynne Gordon and I trained many years ago as a therapeutic radiographer. I'm going to come on to that later because I'm making that the career spotlight as part of this presentation, but I'm going to talk about all the allied health professions that can undertake degree courses so that you can get a feel for what your options are, as well as looking into medicine, dentistry and nursing, etc. So the first slide I'm going to show you is just to give you an idea of the variety of courses that are available to you. And you can see that I've put them into two columns. We have one column in blue and one column in black. And that's because some professions are regulated by a body called the Health and Care Professions Council, and those are all the ones in blue. Now, I haven't put every single profession that's regulated by the HCPC onto that list because some of those roles are not patient facing, and what I wanted to do was just to give you an idea of the sorts of roles that you can do in the health service where you would be face to face with a patient clinically and therefore really contributing to the health and care of those patients. Other professions not listed on there are things like people who work with hearing aid fitting, clinical scientists and biological scientists, and they're the people who do a lot of the testing and working out what's wrong with people behind the scenes, but they're not necessarily face to face with the patients. So there might be a few careers there that you're not familiar with. So I'll just go through a couple of them, and I've put therapeutic radiographer at the top because that's my profession. Obviously, I'm a little bit biased. But a therapeutic radiographer is a cancer specialist, and I will come on to that when I do the career spotlight later. Paramedics, very much in the news at the moment, ferrying lots of patients to and from hospital because of the coronavirus situation. But as you go down the list, people who are really important to people who have had amputations or disfigurements, etc., are prosthetists and orthotists. So a prosthetist is somebody who will construct a body part that has been removed during surgery or maybe an amputated limb, etc. So they're really important people in helping our patients maintain function so that they can go about their normal daily lives. You might have a patient who maybe has lost an eye due to an accident or cancer, for example, and so a prosthetist might actually construct a fake eye, and they're really great artists because they have to completely match the opposite eye so that it looks the same in terms of colour, size and shape, etc. So it's a very skilled job. Orthoptists is to do with eyesight, so they work alongside opticians, and then you've got art, drama and music therapy. So with that particular career, you probably don't need as much science background as you would do with some of the other careers because it's more based in the arts. But again, these therapists work really well with a variety of people in order to help them recover from particular illnesses and conditions and cope better with normal life. The other list with midwives, nurses, psychologists, etc., those are all careers that are not regulated by the Healthcare Professions Council, but they will have their own regulatory bodies. So doctors through the General Medical Council, for example, nurses and midwives through the Nursing Midwifery Council. I'm sure the other speakers will talk to you about that anyway. Now, one of the things that I thought about was, if I'm looking for somebody to come onto my programme as an admissions tutor, what sort of qualities am I looking for? And I think probably key to any healthcare profession is those underpinning values for the NHS. These are things that we want anybody who works in the NHS to have. So even before we look at your academic profile and whether you're members of clubs and societies, etc., we want to know that you've got the personality, compassion and resilience to work in the NHS, face to face with people who are sometimes at the worst point in their lives. So if you have a look at this, there are 6 of them, and I think they're probably pretty common sense really, but working together, respect and dignity, commitment to quality of care, compassion, improving lives and everyone counts. And I think underpinning all of those for me is the ability to communicate and communicate effectively. So I'm looking for people who are a real people person. I'm looking for somebody who is able to talk one-to-one and have a really good conversation. and doesn't get stuck for words when they're talking to people. My students tell me I'm really gobby and I just carry on chatting, and I think that's a typical health professional would be able to do that, because being able to talk to your patients, you get an awful lot of information. Being able to look at a patient and read their body language is part of communication, and you'll probably notice that that's a lot more difficult over the internet than it is in a face-to-face situation, when you've done lots of webinars and Zooms and things. But it's a key component of any health program that we're looking for. So when we're assessing applications for health programs, we're looking at that whole rounded person. Yes, academic achievement is one part of that, but you know, if I had somebody who'd done a PhD in astrophysics and was the most intelligent person in the world, I wouldn't take them onto my degree if they couldn't communicate and empathise and be compassionate, because that's not the sort of person I want working with the patients in the future. And at the end of the day, my job is to provide part of that workforce in the future. So have a think of all those different attributes and values, and think about that list of careers that I showed you before and how they apply in each case. Now, one of the things that you'll be interested in is thinking about, well, okay, you've talked about the personal qualities, but what about the entry requirements? Now, this is going to vary from university to university, and almost a little bit between different courses as well. So first of all, we're looking for most courses in the allied health professions to have a really good GCSE profile. So that's looking grade C in the old scheme, a number 4 or above in the new scheme. And we want to see that you have aptitude across a range of subjects, because that tells us that you've just got that intellect and that the cognitive skills to be able to switch quickly from one topic to another. Depending on whether you're doing BTECs or A-levels with your sixth form studies, then we're looking for BTEC merit and distinction profile, and A-levels, a 96-point profile would be equivalent to 3 Cs at A-level. So it depends on which program, how popular that program is, as to what you'd be looking at. So currently at my university we have 112 points for my course, which is Therapeutic Radiography, but the Diagnostic Radiography, our sister course, is at 120 points. And that just is because radiotherapy is not such a well-known profession. People don't know about it. It's no less technical than the other one, but because Diagnostic Radiography gets more applicants, they can afford to push the points up a little bit. When we're thinking about the health degrees that you apply for, remember I said that all of the courses are regulated by the HCPC, and at the end of that, graduates will be able to register as a state registered professional. Because the HCPC regulates the courses, it means that the course content is very similar. There are specific things that we have to meet within our course content. So when you're making your university choices, it may come down to looking at which university you want to study at, rather than what the course content is going to be, because the course content will be very similar. It'll just be packaged in different ways in different universities. So do your research really carefully, visit a lot of universities either virtually or in person as much as you can to get a real feel of where you want to study. Not all universities offer all courses. For example, there are, I think, 11 institutions across the whole of the UK that offer radiotherapy, but there are 20, I think, that offer diagnostic radiography. So, you know, you might go to a particular university that's got a really good reputation for health courses, but then find out they don't offer the one that you're specifically interested in. So you are going to have to do quite a bit of research. Now, the extended projects there, we count the points in our program for that. Some universities might not, but what that particular qualification shows me is that somebody is able to go away, do independent research. It extends your cognitive skills, and it's just an added extra that I really like to see if people can fit that into their study schedule. So it's well worth doing. And if you can do it on a topic that is related to your chosen future profession, that's going to be beneficial to you as well. So we've talked about the key qualities for health careers. We've talked about communication, interest in people. But the other thing that is really important is that you have to treat everybody equally, whether they are the same cultural background as you, the same religion as you or not. All of those things are really important. We cannot judge people. We have to treat everybody equally. If somebody who's a criminal comes in for treatment, they are still a person and they still deserve the best possible care that we can give them. Most of the professions are going to involve some form of technical expertise, and that will vary from profession to profession. So in my profession, this is a picture down here on the bottom right hand corner. You can see we scan patients, we interpret images, as well as the diagnostic radiographers do. So you're going to learn that on the course. With other professions, it might be using the equipment that they use to manufacture the prostheses. With physiotherapy, there might be respiratory equipment that you have to get handle on. So lots of different skills to learn. In most of these professions, you have to be a team worker and you have to be physically fit. The average radiographer, whether therapeutic or diagnostic, will be walking around about 14,000 steps per day. So if you're not fit when you start, you certainly will be as you go along. And I'm pretty sure my nursing colleagues would agree with that as well. Now, one of the things that you're interested as well, you get your degree, what do you do with it? You might go into your chosen profession and then after a few years you think, well, I might want to change. So I thought I'd just put a little bit about career progression in as well. So this lady in the middle is a lady called Suzanne Rastrick, and she is the current UK head of the Allied Health Professions Council. Very important person. She communicates with the government about all sorts of policy, and she started life as an occupational therapist. So you might want to go into government regions. You might want to do education or lecturing, so research. This is in radiography. This is a lady called Rachel Harris, and she's the head of research at the Society of Radiographers, but she started life as a therapeutic radiographer. This is one of my colleagues who works as a consultant radiographer at Peterborough District Hospital. Again, she started as a therapeutic radiographer, but she now works alongside the consultant documents. She has her own caseload. And so there are clinical careers as well as the management pathways. Kevin, another one of my graduates from years ago, he works now at University College London, and he's now Director of Cancer Services. So he's gone the management route rather than the clinical route. And then Laura, another one of my students, she's done some work with Public Health England, and so she's kind of a clinical communicator with Public Health England, so looking at a lot of cancer strategies, smoking related education stuff as well. There's also health agency work, manufacture and sales. Sorry, I'm really conscious of the time, so I'm speeding up a little bit. So the career spotlight in therapeutic radiography, not many people have heard about this, which is why I decided to do the spotlight here. And basically, a therapeutic radiographer is the only profession in the health service that will deal with a cancer patient from day one of their student training. So they really are the experts in cancer and its management. So the first image, this is part of the treatment planning. So you start off seeing patients after they've been newly diagnosed and you plan their treatment. What this image is showing is where the beams of radiation are being focused in order to hit the cancer, which is covered by this blue line here. This is a linear accelerator, so this is the kind of really technical equipment that you'll learn to use during a program in radiotherapy. And what we're looking for is delivering that really high dose radiation very, very accurately. We also need to be able to interpret medical images. So this is a reconstructed CT scan in 3 dimensions. If this was on our computers, it would spin round and we'd be able to look at different things. But what this image here is showing is the spinal cord in yellow, the whole of the lung in blue, and then the red bit is isolating a cancer within that lung. So we need to know an awful lot about anatomy in a lot of detail. But as I said at the beginning, a lot of the work of any health professional is communication, and as radiographers we do an awful lot of talking to our patients to make sure that they're getting on all right with their treatment and making sure that they get the advice and support that they need. This is the latest high-tech equipment, so it does a similar thing to the linear accelerator. This is called a cyber knife, looks a bit like a car factory robot because that's where the technology originated, but it just means it's an extra accurate way of treating cancers. So all health professions that have content regulated by the Healthcare Professionals Council can be studied at university. So of course you need to be careful of your choice. You come into these courses because they're vocational, so you won't put on your UCAS form, oh, I'll apply for radiotherapy and I'll apply for physiotherapy and I'll apply for diagnostic. You'll come in and you'll know exactly what course you want to do. A therapeutic radiographer would not be happy working in diagnostic radiography and vice versa. Do as much research as you possibly can. Make sure that you've looked at all the options carefully. My background, I thought I wanted to be a dentist. I spent a day with my own dentist having a look at the work that they did. I was thoroughly bored. And then I went to my careers library. I found a little leaflet, just a 2-side leaflet about radiography, spent a day in a diagnostic department and a day in a therapy department. And as soon as I'd spent an hour in the therapy department, I was absolutely hooked. And that's been my career for 30 years. Excuse me, although teaching these days. Make sure when you're preparing for interviews that you consider those NHS values and how you might meet them. Think about times you've worked in teams, think about how you've worked independently, what your response to stress and coping is, because you're going to see some people with some quite, you know, sort of like upsetting conditions when you work in any part of a hospital. And if you really want more information about a particular career, contact the admissions tutors at whichever universities you're interested in, because they are the people who can give you the expert knowledge on what happens within their particular institution. The final thing is be prepared for very hard work. With any of the health degrees, you're going to do what's called a compressed timetable, because you've got to fit in about 17 weeks of academic work and 17 weeks of clinical practice work each year. So as compared to somebody who is doing a geography degree, you'll be doing much more out in placement, you'll have less holiday time. So you need to think about how you're going to support yourself financially through uni as well, and where your placements are. So we have placements, for example, as far south as Portsmouth at the moment, and as close to Hatfield, where I'm based, as Northampton and just in North London. So just bear in mind all the logistics around your chosen course, as well as the other things that you might think about, like social life, etc. So that's me finished. I hope that's been a useful and very brief zoom through allied health professions. I've tried to keep it as general as I can, but obviously if you've got any specific questions, I'll ask them in the chat in just a moment. Thank you.